Hello everyone and happy Thursday. Today I'm on with my full body silicone baby girl Esmae, and Esmae is 10 inches tall and she is anatomically correct, so she have little girl parts, and she is created by Torydolls. And today we're participating in Theme Thursday, and we also want to bring awareness to sickle cell. The month of September is sickle cell awareness, and the color for sickle cell awareness is red. So Esmae is also participating in Theme Thursday, and the theme for today is birds or anything that flies. Yes. She's wearing this two-piece set that I had purchased from Etsy, and this is the blouse. It's white and it has red, white and black little ladybugs, and the theme is birds or anything that flies. So this goes perfectly for Theme Thursday, and also the color red for sickle cell awareness. And the little diaper cover, these little bloomers, is in the color red with white polka dots, which is perfect for sickle cell awareness and also Theme Thursday, which is birds or anything that flies. And then I just made her this little headband. The band is white and it has this little red and white bow. The bow is red, has little white stars. Yeah, so she's going to wear that, and her little frill socks. Yeah, her little frill socks. All right, so I hope everyone is having a great day. I really wanted to, I know the month of September is sickle cell awareness, and I really wanted to come on and participate to bring awareness to it, because sickle cell is something that runs in my family. Yes, I had a niece that had passed away due to complications from sickle cell. Sickle cell is a genetic disease. It's something that you inherit from your parents. It is not something that is transmitted or anything like that. It's genetic, so it's something that you inherit from your family. So I'm just going to take off this t-shirt or undershirt off of Esmae. Yeah, so again, sickle cell runs in my family. I carry the trait. My husband also carried the trait, which means that there's a possibility that any children that we have has the possibility of having the trait or having the disease. Now, the trait doesn't, in most cases, I'm saying, doesn't affect you as badly as having the disease. And I'm saying that because, I'm saying in some cases, because I've heard of some persons who have the trait and who have been badly affected by it. I've not heard of anyone dying from having the trait, but there have been many persons that died from having the disease. Yes, and what happens when a person has the disease is that because the blood vessels are created in like moon, looks like, okay, the blood vessels are normally round, so it flows well in your blood, in your veins. And sickle cell has moon cells, and what happens is that it doesn't flow well in your veins, and because of it, it can cause a crisis, meaning that it's not flowing very well in your arms or your legs. So many persons tend to have like pain in their joints, like in their elbow, in their wrists, in their knee. Yeah, and if your blood isn't circulating well, you can also get a heart attack. You can get a stroke, I should say. You can get a stroke. And that is something that had happened to my niece. My niece had a very difficult time growing up. We had no idea. We had no idea when she was a baby that she had sickle cell. So there were many times she was crying and in pain, and we had no idea what the problem was until one day my sister decided to take her to a specialist, and the specialist is the one that brought awareness to us that she had sickle cell. And then that was the first case that we learned about in the family. But learning about sickle cell back then, there wasn't very much information about it. And you hadn't heard very much about it. And my niece passed away 8 years ago. This month would make 8 years. She was 16. So that means she would have been 24 this year. So 24 years ago, there wasn't very much information about sickle cell. So there were many times she was in excruciating pain. Nobody knew why. She kept crying, until she was old enough to talk and to say, that she was having pain in her arm or in her leg. And then when she was about 5 years old was when she had a stroke. Yeah, so she had a stroke and it affected her on one side of her body. So one side of her body, she tend to drag. And as she got older, because she passed away at age 16, as she got older, her walk improved, but she always had that limp, and one of her leg never straightened out. It never did. So she always had that limp to one side. So, for me, bringing awareness to sickle cell is very important. And as I said, I have the trait, my husband have the trait, therefore our daughter have the disease. She's been doing very well, I will say. And she has been living on medication from she was maybe 2 weeks old, which is amoxil and also folic acid. So she's been doing very well, and what that does is it builds up the immune system. Yeah, but she's been doing very well. Sickle cell persons are affected in different ways. My niece had it very, very badly. My daughter doesn't have it as bad. I would say not as bad. My daughter been hospitalized twice when she was about, I think she was a year or 2 years. And she's been doing pretty good since. There were times when she was sick, very high fever, and we continue to give her medication, and she did well. Kids will get sick regardless. Since she was about 2 years old, she have not been in the hospital. She takes her medicine every day or almost every day. I make sure of it. I always ask her, did you take your medicine? I'm trying to train her to take care of herself. She's 13 years old. You know, I need her to understand. She understands how serious her condition is. She understands that. In fact, she have had lessons on it in school, which is great. They're educating the kids in school about it, bringing awareness to sickle cell, which is great. So I ask her just about every day, did you take your medication? And she'll tell me yes, or she forgot, and I'll remind her to take it, and she would drop whatever she's doing to go and take it. And again, it builds up her immune system. If she catches an infection, it helps to fight the infection, helps to keep her healthy. And she have not been in the hospital since she was about 2 years old. And like I said, I think it has to do with the fact that she doesn't have it as badly as my niece did. Now, my niece never did take medication because at that time we were really not familiar with it. It's not something that we knew very much about at the time. At the time, I doubt that there were even any medication. We hadn't heard about it. Yeah, so, but today, you advise what helps your blood. If you have sickle cell anemia, what helps the blood to flow well is if you drink lots of water, you eat healthy foods, fruits and vegetables. And I notice, like, whenever my daughter eats really badly, like she drinks a lot of soda and stuff, then she starts to complain about about pain in her joints. And I'll remind her, no sodas today, no fruit juices today, just water. And in like 2 days, she's back to herself. Yeah, so it's just a matter of being cautious and taking care of yourself. But like I said, you have some persons that have it worse. I don't understand what's the difference. And I know there's a difference because from my niece. My niece had it really badly. Again, she had a stroke too. So, but my daughter, she's doing very well. She is. Now, I'm not encouraging her to, see, you have to learn. Like I explained to my daughter, if, when the time comes and she starts to date, she has to find out the history of whomever she may be interested in. She has to find out their medical records, find out if sickle cell runs in their family, because it's really not advised to marry someone that has the trait or that has the disease if you are a sickle cell person, because it passes on to your children. And in many cases, many women are not advised to have children because their bodies cannot handle the pressure of carrying the child to full term. So, yeah, so, that is why I had to come on and make a video with my little Esmae for sickle cell awareness and also for Theme Thursday. So that's little Esmae North, dressed in her little outfit. Now this outfit I purchased from Etsy. And what's the name of this lady that I purchased this from? Give me a minute, it'll come to me. Well, you know what? I definitely will include it in the description. The name of her store. I always purchase from her. In fact, I bought a few of these little two-piece outfits because they're such a great price. She sells these for like $9 for the set, for the two-piece, which I think is awesome. And if you spend, I think, $40, you get free shipping. Something like that. Yeah. So that's it, everyone. So thank you all so much for watching, and this is my little Esmae again. A cute little self. Again, she's my full body silicone baby girl, all dressed for Sickle Cell Awareness and Theme Thursday. So thank you all so much for watching, and you have a super great day. Bye-bye.